Hi, I'm Sherry Harlan Davis, program host for Reid Beside You. And today's episode, we have guests from Reid Health and from Meridian Health Services, and we're going to talk about the nest. And before we start talking about the nest, I'm going to let my guests introduce themselves. And we're going to start with Dr. Brandenstein. And please let us know how you came to Reid and how long you've been here.
All right. Well, my name is Dr. Erika Brandenstein. I am an OB provider with Reid OBGYN, and I'm also the medical director over at the Nest. I am a Hoosier, born and raised in Indiana, went to the University of Notre Dame, and Indiana has always been my home, and I've been at Reid for 10 years now.
Great. And our next guest is Shannon Fanning.
Hi, well, I'm Shannon. I have been with Reid for about 16 years now. I started the year after I graduated high school as a patient care technician. I'm now a registered nurse. I have a background in med-surg and pediatrics, and I'm currently the director of Post-Acute and Community Services with our Continuum of Care department and the Nest.
And also, we have from Meridian Health Services, Mischa Spencer. Mischa, can you tell us about yourself?
Hello, I'm Mischa Staton, and I am regional manager for Meridian, basically the eastern part of the state. I've been with Meridian about 11 years. I started out as a behavioral clinician, which is kind of equivalent to a case manager. I then worked my way up to an OC who has supervisory roles. Then I was an operations manager, practice manager, and now I am regional manager. I've been in the position for about 4 years, and I oversee the Nest and other psychiatry services. I do the adult population. I do our intellectual and developmental population. I do our children's population and also our foster care program.
Okay. And tell us, how did you, Mischa explained what the Nest is, and how did it come to be?
So the Nest stands for nurturing, empowering, sustaining, and thriving. And it came to be back in 2017 when we started the program in Muncie in Delaware County. And we wanted to replicate that in Wayne County. And so Reid kind of approached us, and it got derailed a little bit due to COVID, but basically the Nest is a place where mommies and babies can come for support and treatment for substance use disorders, and to have a place of comfort and peace and to feel supported.
And what is Meridian's role at the Nest?
So our role is basically we take the whole health of our patient. So we meet the needs of each woman. We try to do that in conjunction with other ancillary services. So we do case management, we do therapy, whether that be like individual therapy or group therapy. We do positive parenting, education, development, and other substance treatment with a focus of the underlying use and like the root cause of use for the women and their families, and how we can process that and you know, I guess give them the understanding and the knowledge to build those coping skills through therapy, and then having a positive family plan to move forward.
And what is Reid's role in this partnership?
Well, as far as my role goes as a physician medical director, I'll be providing OB care for all the women during pregnancy and after pregnancy, and then also medication-assisted therapy for women who are having issues with abusing opioids, like heroin or prescription drugs.
Okay. And one of the, before I get to the goal of the partnership, I wanted to let our viewers know, one of the, a number that stood out for me was from January to August of 2019, Reid had 543 deliveries, and of those, 170 of those had a positive drug screen at the time of delivery. So that's definitely showing that there was a need. So because of that, so the goal of the partnership is, I'm sure, to combat those numbers, I'm sure, but what else?
Well, we definitely want to just give women hope to get a chance to break the cycle of addiction. One thing that I was noticing with all of our pregnant patients that were coming in and out, I would oftentimes sit at the bedside and speak with them. And, I noticed that they were good women, just like anybody else. They wanted to be good mothers. They wanted to care for their children, and they didn't want to be trapped in addiction, and they needed hope and they needed help. And that's really what the Nest and our partnership with Meridian is all about. It's about making sure women get the care they need and giving them a chance to succeed in fighting against and beating their addiction through medications, through caring for their bodies properly during pregnancy, and also through social services and psychiatric services and support groups and prenatal classes and all the things that we'll offer all in one place at the Nest.
That's great. I know that just in speaking with others in the community, often people will assume that there was already a service like that in the community, and there wasn't. So when people actually wanted to reach out, there was nowhere for them to reach out to. So it sounds like the Nest is a great place for them to be. What are some of the services offered at the Nest?
So what I will be doing is all the prenatal visits. You'll be able to get prenatal visits at the actual Nest facility. We're going to be offering classes on childbirthing, on lactation support, on parenting, to help women prepare for their delivery and also to help support them after delivery. We even have a little store in our place where women will be able to have the opportunity to earn items for their babies through their participation, and just to help build a community around them. A lot of women that are struggling with substance abuse don't actually have a lot of family or home support. And I mean, if you see the place, you can actually go to the website and there's a virtual tour. It looks like a nice living room, and a nursery. It's meant to make women feel comfortable and all in one place provide them everything that they need to succeed.
And you did point out that often people who have substance misuse issues are alone. Their family often in certain situations has given up on them, don't come around us. So to have that support system is truly a need. And when you're, what exactly is Meridian offering to the patients?
So we offer case management and group therapy, individual therapy, and other services if they need help with transportation or housing, or they want to get their family into services, the children that they have. So the beauty of the Nest is that they can bring their babies with them while they're receiving treatment. And then we can also provide any type of services for their significant other, like I said, their other children, on an individual or group basis, whatever is best for them. So we will individualize their treatment plan.
Then during their pregnancy, are you with them through the entire pregnancy? I know you were saying like prenatal, all through the pregnancy, and then after the pregnancy?
Yes, women can initiate their prenatal care through our program. If they're coming in later in pregnancy and they're desiring to get help, they can join later in pregnancy and even in postpartum. And our plan is to continue with these women after the pregnancy for at least up to 6 months, and then beyond that to make sure that they continue to get the care that they need.
Mischa, you had said about case management. We're all in healthcare, so we know what case management is. But to our audience, what happens during when you receive a case manager, and how do they work with you? How does that work?
So our case managers are technically known as behavioral clinicians. So they will work with skill building and, building those coping skills, that resiliency, and learning how to cope with whatever mental health issue may be going on in addition to the substance use. So they happy to be there to link them to resources, but also to work with them on their individual skill building and building those skills to lead an independent life and to be a great mother, which they all want. That's the end goal. So we have our BCs, which they're referred to do those case management type services.
And how does one become a client at the Nest?
So there are several referral methods on how patients can come and become a patient at the Nest. Like Dr. Brandenstein said, we do have a website, reidhealth.org/nest, and patients can go there and actually get further information about the program. Again, they can take that virtual tour. And there's also a contact form that they can fill out, and that goes directly to our perinatal navigator, who then would reach out to the patient to give them additional information and get them set up for an appointment. They can also call the OB/GYN office here in Richmond and request more information for the Nest, or they can reach out to Meridian Health Services requesting that information as well, and they can get the patient set up for appointments.
And what's the criteria for an ideal patient? For instance, I'm watching this show, I know someone that is expecting and they have a substance misuse issue, and I want to refer, can an individual refer them, or does it have to be through their physician? How's that process?
So we can do self-referrals, of course. We also have referrals, at least on the Meridian, through DCS or probation, corrections, any court system. So we want to have as few barriers as possible to getting ladies in. But basically, if there is a woman who is 18 or older who either is pregnant or recently has delivered a baby and would like to seek help, we are more than happy to get the ball rolling and get that going for them.
Okay. And the criteria for an ideal patient?
I don't think that there's any person that we would turn away if they do want help. But basically, if they're 18 years or older and either are pregnant or recently delivered, that would be the ideal patient.
And often, one thing I didn't hear or say, because people automatically assume just of the major, what's perceived as a hard drug, an opiate, but alcohol. If they're suffering from alcohol misuse, would they be a candidate to come to your program?
Absolutely. Any woman with any substance use disorder is going to be welcome at our practice. As far as medications go, it would be the women that are using opioids like heroin or some of the medicines that you can get on the streets that are prescribed medicines. Those are the women that would meet criteria for medical assisted therapy, because I do prescribe what's called the opioid agonist medications, Subutex, and is the one that we primarily use because it is not recommended for women to withdraw from opioids in pregnancy. And so we will offer that. But as far as like the prenatal care and all the support offered and services offered through Meridian, any substance use, any woman using any substance will meet criteria. And then if we think that they need additional resources, that such as like inpatient rehab, anything like that, if we determine that they would be a good candidate for that, we can actually help initiate them getting those services as well.
And Dr. Brandenstein, can you tell us a little more about MAT counseling?
Sure, absolutely. So there are several things that can happen with women who abuse opioids during pregnancy. They're at increased risk for developing complications with the pregnancy, like low birth weight, preterm labor, even some birth defects. And women who are treated with what we call opioid agonist therapy tend to do better, to have better birth outcomes, and even babies tend to have less severe withdrawal following the pregnancy. These medications can be absolutely life-saving for the infant because acute withdrawal from opioids in pregnancy can actually be harmful to the fetus, and even can, in some cases, can even cause stillbirth. So any woman that's abusing opioids, such as probably heroin and fentanyl, are the ones that we're really seeing a lot of. But even women that have gotten addicted to prescription medications, those would be good women that would meet criteria for what we call medication-assisted therapy with Subutex, and I would be able to prescribe that for them.
And I highlighted that issue because often when the general public sees someone who is suffering from a substance misuse and they find out that they're pregnant, people will just say, well, they should just stop. Can't they do this or whatever? And then everything will be fine. And so I'm glad you explained to us the medical things that could happen to them if they did not go through a medically assisted treatment plan.
Mm-hmm.
Another thing is when we're looking at the referral process, you have, when you did mention earlier, I also want to highlight that when what we're seeing right now are you three on the screen, but there was an entire group of people that worked together from law enforcement, probation, an entire village that came together to create the nest. So are those people still involved with, and they can do referrals as well?
Yes, absolutely. We had, I think, over 50 stakeholders throughout our time when we were trying to get the nest up and going. And they're more than welcome to do referrals. They're still involved. I still get emails about questions. So it's pretty exciting that everyone in the community are really backing this. And we're glad to have them on our side.
Another problem people often have, that they don't have insurance. Is there, and I understand there's an insurance navigator on site at the nest?
We do have a perinatal navigator,
okay.
And so that is a part of her role, is to look at insurance and what type of resources the patient does and does not have, and then helps them navigate through the healthcare and through the community to find the appropriate resources. So our navigator, they do work very closely with our claim aid department within the hospital. So if we do come across any patients that do not have any insurance company or coverage, she gets them connected immediately, and then can also provide community resources if they're having transportation difficulties. That's all things that she can help assist with for all these patients.
That's great. So as we continue to have the one-stop shop, tell us why this program is so vital to the community.
Basically, I just think we're just giving hope. We're giving a chance to these women that want to parent their children. They want to be good moms. They care. And we're just giving them a place where they can go to give them a chance to turn things around. And pregnancy, I think, is a wonderful opportunity for women to do that. Actually, in women, as far as substance abuse goes, the reproductive years are the most common years that women will likely get involved in substance abuse. And so it just gives women an opportunity to go to one place where she can get everything that she needs to turn things around.
And the other really good thing is they can bring their baby with them once they have had their baby. So often lack of child care prohibits people from doing different things, but to participate in this program, you can bring your baby with you, correct?
Absolutely. We even have a cute little nursery area and a baby play area, and it's very family friendly, family oriented, and we do welcome women to bring a child.
And what are the other needs? You did hit on that earlier about other community resources that are available. that you partner with, the other needs that are addressed. So if you could they help with housing, or like you said, transportation, or at least get them in the correct direction?
Yeah, definitely. Between us and Meridian Health Services partnering together, we can work on that collaboratively with the patient to find the best resources for them. We also have a social worker that we can pull in if there's any resources that we may not be aware of. We can always pull in our social worker to assist with that. Getting them referrals to Birth to 5, whatever that community resource they need, we will find it for them and get them set up in the best situation possible.
And I see that there's a slide that has the various services that would be available. I know one of the big things is, especially for moms that would definitely be in need, car seat safety, and teaching people how to utilize a car seat. And just for the safety factors, that's a big push.
Absolutely. Like in addition to that, just parenting classes, safe sleep instruction, even infant CPR are things that we're going to be focusing on offering women just to help reduce risks of an adverse outcome.
The another thing for Dr. Brandenstein, you are actually trained in
Excuse me.
MAT training, correct? Able to deliver the drugs to the patient, correct?
Yes, I actually got a special certification. I had to do additional training in order to be able to prescribe these medications for women. So I'm officially certified to do that and just to provide ongoing care through the pregnancy and in the postpartum period.
And just I can't express how much I'm excited about this offering. And for instance, what would happen if I had a family member I'd like to refer, but how can we get them encouraged to participate in your program?
I mean, I definitely think the website is a good resource for them. Even just, seeing what, I think that the fact that there's a virtual tour presents a good presentation of what we're trying to accomplish, and I think the theme of the nest, like the nest being a nurturing place where you can feel safe and where you can feel supported. A lot of women feel very judged when they have substance use issues, particularly during pregnancy. But I think what I really want women to know is that they will not be judged, and that our goal is to provide them with all the tools they need to meet their goal, which is just to be a mom, to be a good mom.
And then the virtual tour is amazing. Said, I think I went through the tour 2 or 3 times because I think I missed something. So it's very interesting to go through, and I can't wait for the public to actually have a chance to look at it. Another key point is that where the nest is located, and because it's in a walkability area. So even if you didn't, people that lack transportation, you could get to it via public transportation, or as you said, that we can work with people to get them to that location. That's always a huge benefit, because a lot of times things, as being out in the community, things are designed not often people overlook the major need of transportation and getting people to where they need to be. So that's a big plus. And I just want to review on the contact information. So you said some of the best ways would be to contact. Would I contact Meridian? Do I contact Reid? What's the best way to get in touch with the nest?
You can either use the online form on the website that goes again directly to our perinatal navigator who would be scheduling patients. We also have our telephone that is for the nest. It's directed right to our perinatal navigator. That's 765-756-7001. So they can call there, or they can call Meridian Health Service. They would be more than able to get patients connected to the right route as well.
Yep, that's definitely a possibility. They can call our number, which is 765-935-5390.
And are you accepting patients currently?
Yes, we are.
We are.
Absolutely.
So a person could ring that number and get in touch with the perinatal navigator instantly. So, well, we want to thank all of you for joining us today. And I've learned a lot, and we hope our viewers have learned a lot. And we are so blessed to have the nest as an option in our community. So we want to thank you all for joining us today on Reid Beside You. Thank you.